Hi everybody, happy Thursday. Welcome back to our Next Gen NCLEX review session. We're so glad you guys are here today. Today is like kind of a culmination of our big diabetic ketoacidosis week. So we're going to jump into a case study here in a little bit, but we're going to make sure that all of our technology is working on all of our platforms. So hello to everyone on YouTube, Facebook, TikTok, Instagram. We're so glad you guys are here. Make sure you use that chat function. Let us know, as always, we love to know where you guys are joining us from. So feel free to drop that in the chat. Let us know what classes you're taking. Let us know if you joined on Tuesday too. So that'll be really helpful for what we're going to cover today. But as soon as I know we're good to go, we'll go ahead and jump in and get started on everything. But I think, okay, we are good to go. Got a green light from everybody. Thumbs up. So officially, hello and welcome everybody. My name is Jackie and I am a nurse here at UWorld. We're so glad you guys could join us today again. We are going to be walking through one of UWorld's NGN case studies on diabetic ketoacidosis. So we're going to talk about content for DKA. We're going to walk through each question, talk a little bit about the clinical judgment measurement model, and then just kind of do this all together so you guys will have a chance to answer each question. We'll talk about it and then we'll kind of preview what it looks like to be in UWorld's platform as well. So as always, our schedule, we are live on Tuesdays and Thursdays at noon Central Time. You can find us on demand on Facebook and YouTube. And especially we have two sessions we would recommend you guys watch. So we had one of our content developers, Mel, do a really great walkthrough on case studies in general. So if you're new to case studies, it would be a really great starting point just to get a feel for the different types of question types that you'll see in a case study and walking through that clinical judgment measurement model as well too. So we encourage you guys to check that out. And then also on Tuesday, we walk through DKA in pretty good detail. So if you're going through this content and you want to kind of learn a little bit more about DKA, check out that DKA review session that we did on Tuesday. So let me just make sure I've covered all the things. Okay, most importantly to all of you guys, make sure you share this live, especially if you're on TikTok. We want all of your friends in nursing school to join us. The more the merrier. This is a really great opportunity for us just to kind of showcase what a case study is going to look like. So make sure you share, especially if you're on TikTok. I'm going to just check in with our chat here. I'm on some more screens than normal today, so that's why I'm kind of over here. But let's see, we have people joining us from all over: Chicago, the Philippines, Ghana, Kenya, Illinois, California. Amazing. Oh my goodness. Nepal, North Carolina. So great. Well, welcome everybody. We're glad you're here. Okay, we've talked about our schedule. We've talked about what we're going to talk about today. Next week, we're going to kick off Mental Health Month with some common psych disorders and common psych meds. So make sure you come back next week. And as always, we have our content experts monitoring the chat. So if you guys have any questions about case studies, the content, feel free to ask them as we're going through. I'll be looking at them, but we also have content experts looking at them as well too. Okay, so again, we're going to do a screen share today, but before we get into that, we're going to talk just a little bit more about kind of UWorld and the NCLEX. But whenever we get into the screen share, what you see on your screen is really going to mimic what you see on the NCLEX. So we know taking the NCLEX is stressful. So knowing how to navigate through questions, we can take that kind of anxiety out for you. So when we walk through this, you'll see what the split screen is going to look like. You'll see how to click on things, and that's really going to hopefully relieve some of that test anxiety that you might have on test day. And when you get in there, it's going to look familiar. It's going to look like UWorld, like you're happy place. So we'll walk through all of that today. And then as we always try and do with these sessions is incorporate some of that relevant content that you guys might find on the NCSBN website or nclex.com and also on UWorld, nursing.uworld.com. But whenever you guys are taking the NCLEX with this new next gen NCLEX, we know the minimum number of questions you can have is 85. And of those 85 questions, you're guaranteed to have at least 3 case studies. So case studies are 6 questions, so 6 times 3 is 18. So 18 of your questions are going to be case studies. So we have here at UWorld tons and tons of case studies that you guys can practice with. So not only will you practice kind of adapting that clinical judgment measurement model, but you'll also practice clicking through and seeing the different item types. So we encourage you guys to check it out, get yourself familiar with what case studies are, how they flow, and kind of how to approach them. But again, we're going to bring up real fast the image of the clinical judgment measurement model for you guys. So again, we're just going to kind of briefly walk through this, and this is really the whole framework, or like the blueprint of the case study. So it's going to walk you through, it kind of adapts the nursing process, but a little bit differently. So as we walk through these 6 questions, you'll really see how they align with the clinical judgment measurement model. But feel free, take a screenshot of this if it can be helpful for you. We're not going to go through all of these steps right now. We're going to kind of talk about how they're incorporated into each of the questions as we get going in our case study. But that is what it is like, or that's what it looks like for you guys, and how it kind of feeds in with the nursing process as well. So that is that. And then we will officially kick off with talking. We're going to do a quick review on DKA, and I hope this will give you kind of just a good starting point so we have the tools and the information we need to answer these questions as we walk through on our case studies. So we're going to pull up again our kind of summary table that we had for you guys on Tuesday for DKA. So as always, we said this earlier, we said it on Tuesday, screenshot this. I hope it can be helpful. Again, it's very general information, but hopefully it can help kind of guide you guys as you're going through. So we're going to just kind of walk through DKA pretty quickly, and then we'll jump into our case study. So quick recap on DKA, starting with the patho. DKA can really only happen in type 1 diabetes, and we know type 1 diabetes is an absolute deficiency of insulin. We know insulin is the key to drive glucose into our cells. Without glucose in our cells have no energy, so our body is essentially starving for energy. When we have all of this excess circulating glucose in our blood, our body doesn't know it's there, so it signals kind of a plan B to create energy. And so it breaks down fat and lipids to create ketones. So glucose and ketones are really only the 2 kind of energy sources our brain can use to function. But whenever we break down the fat and the lipids to make ketones, we do it in excess. And so we have way too much glucose circulating in our blood and way too many ketones circulating in our blood. Those ketones are acidic, and when we have a lot of acidic molecules or particles in our blood, we're going to go into acidosis. And in DKA, we worry about metabolic acidosis. So that's kind of that quick patho of what happens with DKA. And again, when that those high levels of glucose and those high ketones are in our bloodstream, they're going to act as solutes, and we learned about osmotic diuresis. And so another kind of hallmark of what's happening in DKA is that osmotic diuresis. So all of those particles in our blood, our kidneys are going to reach maximum capacity. They're not going to be able to filter all of them out, and they're going to need to start spilling over into our urine. And so when that happens, the glucose and through osmotic diuresis, it's going to pull water from our bloodstream with that glucose and with those ketones, and we're going to urinate excessively. We're going to have that polyuria. So that's going to kind of bring us into that next row in our table, which is what is DKA going to look like. So when we think about these big picture things happening with DKA, we have hyperglycemia. We know hyperglycemia looks like polyuria and polydipsia. We know that when we're urinating these massive amounts of fluid, we're going to have weight loss. We also know that we're going to be acidotic. We're going to be in acidosis, and our body is going to try and compensate for that. So those ketones are going to cause that fruity odor on our breath. That's the smell they come with, but it's not like fruit punchy smelling. It's just like a ripe smell if you've ever had taken care of anyone that has DKA. We're also going to have these Kussmaul respirations, so these really deep, quick labored breaths. And that's our respiratory system kicking in to try and raise the pH of our blood and blow out that CO2 to help kind of get us out of an acidotic state. We're also going to have hypovolemia. Again, this is all relating back to that polyuria. We're urinating out these really large quantities, these really large amounts of fluid. We worry about hypovolemia, and that can lead to hypovolemic shock. So that is really the kind of big implication of DKA. But we also know that when we are hypovolemic and we have low circulating fluid volume, we're going to have hypotension, so decreased blood pressure. We're going to have increased heart rate, so our heart is going to try and push out as much fluid or as much blood as possible from our heart so that our vital organs are being perfused. We're also going to have from that hypovolemia, hemoconcentration of our blood. So our blood is going to have, it's like, we kind of talked about it being a dehydrated pond. We're going to have a normal amount of particles, but we're not going to have a lot of water for them to be floating in. So we're going to have some electrolytes, some pseudo-electrolyte abnormalities where it's going to look like we have like high potassium, but in reality, we just have low fluid volume. So, for that, we're going to worry about the implications of those electrolytes, so how that can affect our heart. So again, kind of quick little recap. DKA, it's happening in type 1 diabetes. We know the big kind of implication of this is we're creating ketones. These ketones are acidotic. It's making us very, very sick. And then what it's going to look like, that hyperglycemia, hypovolemia, and acidosis. And so when we kind of put that together with labs, we're going to have extreme hyperglycemia, like extremely elevated numbers, over 250. We're also going to have ketones in our blood and in our urine. We're also going to have glucose in our urine as well. And then we're going to be acidotic, so we're going to have low pH in our blood. So those are kind of some of the labs. And then treatment. What are we going to be doing for these clients? We know hypovolemia is really where this life-threatening implication comes in with hypovolemic shock. So we have to address that first. So our priority intervention is going to give fluid. So to give boluses of our 0.9% sodium chloride or normal saline, we need to raise that circulating volume, and we need to make sure that volume is staying in our bloodstream and not spilling over into our urine. So we need to counteract that kind of solution that's happening. We also obviously need to give insulin. We know insulin is that key to drive glucose back into the cells. So not only is it going to drive glucose into the cells to lower what's circulating in our blood volume, it's also going to help facilitate more of that glucose in our bloodstream getting out through our urine as well. So our body's going to start working together to get it back into a healthy state. We're also going to need to do continuous cardiac monitoring. So we talked about these electrolyte abnormalities. Our body's going to look like it's hyperkalemic, but in reality, especially once treatment gets going, that insulin is going to take that normal circulating potassium and drive it into the cell with the glucose. So we worry about hypokalemia. So we need to have our client on continuous cardiac monitoring to monitor for any of those dysrhythmias. So those are kind of as much of the basics as I can tell. I hope that's helpful for you guys. I'm going to just check in with our chat, see if you guys have any major questions, and we are going to get started. But thank you to anyone on TikTok who has shared us. If you guys want to keep doing that, this is the time to share, because we're going to jump in to our case study and get started. So feel free to do that. And then we are going to jump in with our screen share. So it might look small at the beginning, but we're going to zoom in on left and right side. I know a lot of you guys are probably watching on your phones, so we're going to zoom in and make sure that you can see what you need to see. So I will just confirm that my screen is good to go, that we're screen sharing, and we will jump into question number 1. So what we'll do is we will I'm going to read this nurse's note. So this is item 1 of 6. So we're going to walk through all 6 of these. I'm going to give you guys some time to kind of answer these, and then we'll go through, and the answers that I select will be the correct answers. So as if you guys are familiar with UWorld and with our platform, you really get that instant gratification after you answer a question to see like our kind of the bread and butter of what UWorld is, which is our explanations. But in a case study, we don't want to give anything away. So you're going to see the explanations at the end once we've answered all 6 questions. But do know the answers that I select on here will be the correct answers. And then once we go through all of this, we'll go back to the beginning and you can kind of see what our explanations look like. So you can see all of that good learning that comes out of UWorld with our images, our explanation about why things are right, our explanation about why things are wrong, and all of that. So, okay, without further ado, let's do this. We're going to jump in. I'm going to read you guys the nurse's note, and then we'll start answering this, and I'll give you guys some time too. Okay, so we have, starting at the beginning here, this item is called a highlight text. So over here, you're going to see that as we kind of skim through, there's some like light yellow that's going to highlight. These are going to be our options. And so we'll go through those one at a time, and I'll let you guys pick them, and then we'll go through and click them. So, okay, anyways. The nurse is caring for a 20-year-old female client. We're in the emergency department. We know this is a critical situation. So reading this, the parent has, the parent brought the client to the hospital after finding the client in the bathroom vomiting and unable to stand without assistance. The client states that she has experienced sore throat and nasal congestion for the past week. She reports 4 episodes of emesis during the past 24 hours and abdominal pain that is diffuse, constant, non-radiating, and rated 3 on a scale of 0 to 10. The client also reports polydipsia and polyuria over the past 2 months. So if we hadn't labeled this live and learn session DKA, hopefully some of this is screaming DKA to you guys. The last menstrual period ended approximately 6 weeks ago with no abnormalities. Pregnancy status is unknown. The client is taking no medications, and she reports no smoking, alcohol, or recreational substance use. Family history includes hypertension and diabetes mellitus. The client appears drowsy and is oriented to person and time only. The abdomen is soft without guarding, rigidity, or rebound tenderness, and bowel sounds are normal. No blood is present in emesis. Respirations are rapid and deep. Breath sounds are clear. We have vital signs here. I won't read all of those out. And then finger stick blood glucose level is 600. That is high. Okay, so let's go over here. I'm going to hover over our options, and then I'll kind of like keep summarizing them. You guys feel free, drop in the chat what you guys think are the right answers. I'm going to check the chat, and then we'll answer it together. So we have as an option sore throat and nasal congestion for the past week. Another option is last menstrual period, pregnancy status is unknown. We have the client appears drowsy and is oriented to person and time only. And then we're going to have some vital signs down here. Pulse 128, respirations 30, blood pressure 88/60, and then our blood glucose level. So again, we have 8 options we can click. Sore throat, pregnancy status, orientation, the abdomen being, I think I forgot to click this one. The abdomen being soft, pulse rate, respirations, blood pressure, and glucose. So I'm going to check the chat, see what you guys are thinking some of these clickable options are, and see what you guys are putting. I'm seeing orientation on there, pulse rate, the vital signs. Yes, those are all correct. Perfect. Blood pressure, pregnancy status unknown, correct? Awesome. Okay. So I'm going to go through and click these. So of our options, sore throat, nasal congestion for the past week. That's not screaming emergency to me. Again, our instructions say click to highlight below the findings that require immediate follow-up. So I don't think a runny nose it's not life-threatening at this point. So I'm not going to click that one. Let's see. Our pregnancy status is unknown. So this is concerning to me because of how a lot of these symptoms are presenting themselves. We have abdominal pain, vomiting. This is something we need to confirm or we need to rule out. So I'm going to say we definitely immediately need to follow up on this one. Let's see. The client appears drowsy and is oriented to person and time only. We should be oriented to 4 things. person, place, time, and situation. And so this is alarming to me too. We know something's going on. This person's also young. We have no indication of other kind of disease processes that should be affecting our mentation. So this is going to cause some alarm for me as well. So I'm going to say appears drowsy and oriented to person time only. This is something we're going to need to follow up on. Again, the abdomen is soft. Soft abdomens are usually not alarming. We're not seeing anything that's indicating any type of fluid or third spacing in our abdomen. Bowel sounds are normal, nothing that's indicating obstruction, so I'm not going to click that one. Let's see our vital signs. This client is definitely tachycardic. They're definitely breathing really fast. Those are going to maybe scream our Kussmaul respirations, and our blood pressure is very low. So these are all kind of lining up with our, kind of idea of DKA. And then our blood glucose level, this is extremely alarming. This is significantly too high. Remember, anything over 250 is kind of grounds for DKA. So let me double check, make sure I got everything, and these will be our correct answers. So if you guys picked pregnancy status, level of consciousness, heart rate, respirations, blood pressure, and our lab value, then you are correct. So we are going to submit those and move on to our next one. So again, item 1 in a case study is all about recognizing cues. So seeing things that are alarming, that are suspicious, that we're like, this is not what should be going on in somebody that is healthy. So this is, again, item 1. We're just seeing big picture. We're pointing out things that are suspicious, not looking right, and concerning. So, okay, let's move on to item 2. Okay, so as you can see on the left hand of the screen, we'll just show you guys really fast, but the scenario is going to stay there, and then our question is going to be on the right side of the screen. So with this type of question, when we go to item 2 of a case study, kind of bringing this back to our clinical judgment measurement model, these are our analyzed cues. So a lot of times you might see these questions kind of bringing in different differential diagnosis. So based on the big picture of like our concerning findings, what do these align with? So this could be like things that have common symptoms or have symptoms in common with one another. So when we go through this, we're going to take them, this type of question, let me back up and say, this type of question is called a matrix multiple response. So this is essentially like 3 SATA questions in one. So it's like a SATA question on DKA, a SATA question on ruptured appendix, a SATA question on ruptured ectopic pregnancy. So my advice to you guys is to, instead of taking these like row by row, is to go column by column and just think about one thing at a time and see how those findings fit in with it. So I'll read the question to you guys too. So it says, for each potential finding below, click to specify if the finding is consistent with the disease process of DKA, ruptured appendix, or ruptured ectopic pregnancy. Each finding may support more than one disease process. So again, when we say matrix multiple response, that multiple response allows us to click more than one box in each of these columns and more than one row in as we go down, or more than one. We're going to have a lot of clicks in each of the columns, but you do have to have at least one thing clicked in each column. So there has to be one overlapping finding for each of these. My rows and columns are, I don't know, getting jumbled in my head. Okay, so let's go through. We're thinking about this as DKA, ruptured appendix, and ruptured ectopic pregnancy. So I want you guys to go through this and decide what you're going to click for DKA. So are you going to have polyuria for DKA, vomiting, tachypnea, tachycardia, hyperglycemia, abdominal pain? Put your answers in the chat, and again, we're just going to do this one column at a time, and then I'll talk a little bit about what happens with ruptured appendix and ruptured ectopic pregnancy before we click those. So let me see what you guys are seeing. So again, we're looking for what our right answers are for DKA. So I see on YouTube, Viola said polyuria. That is correct. Taylor on YouTube said all of those. You are correct. Spoiler alert. Okay. Perfect. Let's see. We've got, oh, thanks to anyone who's sharing us and following us. We appreciate all of that. We're seeing Mirabelle said DKA for all of them. That is correct. Awesome. Okay, I'm seeing a lot. I might have given you guys the right answer a little too soon, but yes, it is correct that we have all of these. We know that polyuria, that is like a hallmark sign of diabetic ketoacidosis. Again, that those ketones and glucose are spilling over into our urines. Our kidneys can no longer filter them out, and they need to filter them out so that they're not continuing to build up in our bloodstream. We're going to have vomiting. That the breakdown of ketones into energy is going to yield a byproduct that once it gets into our digestive tract, it's going to cause that abdominal pain, that nausea, and that vomiting. So this is definitely something you're going to see. You're also going to see tachypnea, so that rapid breathing. This is those Kussmaul respirations. This is definitely true. We're going to see tachycardia. We talked about that low circulating fluid volume, that hypovolemia. So our heart has to compensate to make sure our vital organs are being perfused, so our heart rate's going to go up. We're definitely going to have hyperglycemia. Like we know this person's, there's a 600 that's like way too high. And again, hyperglycemia is again another hallmark sign of type 1 diabetes, but also DKA. And then abdominal pain. We talked about the breakdown of those ketones and how that byproduct is really irritating in our GI tract. So if you guys picked all of them, you are correct. Okay, so let's talk about ruptured appendix. So what happens with a ruptured appendix or appendicitis in general? Appendicitis is inflammation of our appendix, and a lot of times it's because of a blockage or obstruction like in our colon. So fluid is going to get trapped. We're going to have an obstruction that's going to trap like colonic fluid and mucus, and that's going to cause increased pressure and inflammation. And then this is going to impair perfusion to our appendix. So our appendix isn't going to get a lot of blood flow. It's going to cause ischemia. And if we don't rupture it, all of this inflammation, this irritation to our appendix, it can rupture. And when it ruptures, we really worry about the contents seeping into our abdominal cavity, so we worry about sepsis. Again, some of what we would see with a ruptured appendix, we all kind of know that rebound tenderness. So if you push down, pain is relieved. When you release, pain is like, whoo, amplified. Again, if we're worried about sepsis and septic shock, we're going to see a lot of these same symptoms of hypovolemic shock. So increased heart rate, increased breathing, and again, we're going to have a lot of pain in our abdomen. So let's see let me just make sure I'm covering everything you guys might need to know about this, and then we will go through and click these. So ruptured appendix, we're not going to have any implication with our urine. It's really going to be in our abdomen. We are going to have some vomiting because we are, as a response to all of that pain, we can have a lot of vomiting with our ruptured appendix. We're going to have increased breathing. We're going to have increased heart rate, and we're definitely going to have abdominal pain. Again, this is another emergency, and we're going to have a lot of pain from from the rupture happening. Okay, ruptured ectopic pregnancy. We'll move on to our next one. So this is what happens when a fertilized egg implants or grows outside of the uterus, and a lot of times it happens in the fallopian tube. So if left untreated, so if we're not able to remove that pregnancy in the tube, then this can result in life-threatening hemorrhage. So again, when we think life-threatening hemorrhage, we're going to worry about hypovolemia and hypovolemic shock. So again, these are going to be a lot of overlapping symptoms that we would see in DKA. Same idea with this. We can have also obviously abdominal pain because this is all happening in our abdomen, referred shoulder pain from bleeding, and then also other pregnancy-related symptoms like nausea and vomiting. So as we go through this, again, going through this one at a time, our urine is not really going to be affected by this. We are going to have these same symptoms of like abdominal pain, vomiting, and signs of shock because in this situation, we worry about hemorrhage. So we can have vomiting, we can have tachypnea, tachycardia, and abdominal pain. So I'm going to see how you guys did. Good job. Very good, you guys. And I apologize, I got ahead of myself and gave you the answers without letting you answer, so I will not do that again. But good job. I'm seeing a lot of these right answers on here. You guys definitely have it. Vomiting, yes. Oh, that answer was from U World Nursing. You guys got it right. Yes, Viola said all except polyuria and hyperglycemia. Good job. Instagram, I'm seeing vomiting, tachypnea, tachycardia, abdominal pain. Good job, guys. All right, so this is what these answers will be, and then we will move on now to question number 3. So we're going to hit submit, and then we hit next. Okay, so question number 3 in a case study is called our prioritize hypothesis. And this is really where we kind of tie in or hone in on like what we think are big disease processes and what some of those kind of implications are. So really thinking big picture of a specific disease process. So in this situation, we'll read the question and really kind of hone in on what we need to know, what's most important to know about DKA or about our situation. So this is a drop-down question. So you'll see as you click these, there's specific options for you to pick from here, and they will need to kind of match together as you're reading the sentence. So this says complete the following sentences by choosing from the list of options. Complete the following complete the following sentence by choosing from the list of options. So again, based on the clinical findings, so we're really honing in on this client. We don't really think this client has a ruptured appendix or a ruptured ectopic pregnancy. We know all of these findings are really telling us this client has DKA. We know that life-threatening implication of DKA is hypovolemic shock. So let's keep that in mind as we answer this. So based on the clinical findings, the client is most at risk for, our options are peritonitis and sepsis, fluid volume deficit and hypovolemic shock, intra-abdominal hemorrhage and hypovolemic shock, and then what is going to support that? As evidenced by the client's vital signs, abdominal pain, date of last menstrual period. So I will let you guys answer. Again, what we're looking for in that first drop down is peritonitis and sepsis, fluid volume deficit and hypovolemic shock, and then intra-abdominal hemorrhage and hypovolemic shock. So let me see what you guys are saying. Yes, a lot of right answers. Good job. I'm seeing a lot of people reiterating hypovolemic shock, so I'm going to go ahead and pick it. You guys are definitely on to something here. So fluid volume deficit, hypovolemic shock. This is going to be what we're going to select. Peritonitis and sepsis, this is really what we worry about more maybe with that ruptured appendix, and then intra-abdominal hemorrhage and hypovolemic shock is what we worry about more with that ruptured ectopic pregnancy. Okay, and then as evidenced by, so what is going to support our theory that our client is at risk for shock? So is it going to be vital signs, pain, or date of last menstrual period? See what you guys think. I'm seeing a lot of vital signs in the chat already. So you guys are definitely correct. That is it. Vital signs is correct. So abdominal pain, again, that's going to relay more to, it fits in with all of it, but that's not going to support our hypovolemic shock. That's really going to support that ruptured appendix. And then our date of last menstrual period, that's a little bit more pregnancy related. So that's what we're going to worry about for ruptured ectopic pregnancy. So we're going to hit submit. Go on to question 4. Okay, so question 4, we have a couple things that happen here. So on the left side of our screen, we have a new tab that says laboratory results. So we're going to take a look at that, and we know we have a new tab because the question is going to tell us over on the right side of the screen, the nurse has reviewed the information from the laboratory results. So again, this is a kind of a key that we need to check our tabs, see if something's changed. So we're going to look at this. We're confirmed we have extremely high blood glucose, and we have what appears to be high potassium. But we know we're dealing with DKA here. This is maybe pseudo-hyperkalemia. So as we kind of think through that, let's go through and see what our interventions are. So question 4 is all about what type of interventions we're going to do. So what are the, we're generating solutions, we're making a plan of care, we're deciding how we're going to best treat this client. So whenever we are going through that with DKA, we'll just kind of go through this. This question is an extended select all that applies. So we've answered these tons of times, but this just has more option choices for us to go through. So we'll go through this, we'll take a true-false approach and see what our correct answers are. So I'll let you guys take some time, put your answers in the chat. And we we're getting closer to the end. This will go pretty quick as we get past this question. So, 2, 4, 5, yes. On YouTube, that is correct. Taylor on YouTube, correct. Good job, you guys. I'm seeing a lot of right answers. Good work. All right. JC, good job. Good job, you guys. Awesome. Instagram. You guys have got it. Seen a lot of... This was a lot to key in, so I appreciate you guys still engaging in the chat. Okay, so let's go through these. We're just going to take a true-false approach to each of them. Okay, so administer 5% dextrose in 0.9% sodium chloride IV infusion. We have very high blood glucose levels. We haven't done anything yet, so we're not good. This is a false option. We're definitely not going to want to do this at this time, but this is once our blood glucose level maybe gets to a more appropriate level. When we get towards that 200 level, that's when we'll add dextrose into our fluids, but we're not going to do that right now. Okay, so that's not a correct answer. Option 2, administer continuous insulin IV infusion. We know this is like an essential part of DKA treatment, so we're going to click this one. That is true. We have to have insulin to drive glucose into the cell. Again, these clients have type 1 diabetes. They have an absolute deficiency of insulin, so they're dependent on insulin. They have to have it. Option 3, administer sodium polystyrene sulfonate rectally. So this is what we would give if our client had hyperkalemia, but we know in DKA, so it's going to remove potassium through the GI tract. We know in DKA this client does not actually have hyperkalemia. They have pseudo-hyperkalemia, so it's all a reflection of the amount of circulating fluid in our bloodstream. So we don't want to lower our potassium. We're going to actually want to monitor our electrolytes super closely, and we're going to want to administer potassium as we're treating these clients because we worry about their heart. We have to protect their heart from any of those dysrhythmias. So that is not a correct answer. Option 4, check our arterial blood gas levels frequently. This is true. We want to make sure we are getting out of an acidotic state or an acidic state. We want to make sure the pH of our blood is on the rise. So this is, again, one of those manifestations of DKA that we want to make sure is improving. We're definitely going to have to check our finger stick blood glucose level every hour. That's part of the protocol whenever we give IV insulin. We have to make sure, like we know the whole point of insulin is to bring our blood glucose level down, but we don't want it to go down too low where we become hypoglycemic. So we want to check it every hour, and that's also going to indicate how we need to titrate that drip for that client as well. Okay, option 6, initiate continuous cardiac monitoring. This is true. We talked about how potassium is affected with DKA and how potassium affects our heart. It's one of the main electrolytes that impacts the the rhythm of our heart. So we want to make sure that we're monitoring for any of those kind of fatal dysrhythmias. We want to, option 7 says initiate strict intake and output monitoring. This is true. We have with DKA, we have that major polyuria. These clients are urinating so much urine and so much fluid out. We want to make sure that our fluid resuscitation efforts are working and that what's going in, not more is coming out. So this is a situation where we definitely want to make sure we're minimizing that polyuria, we're minimizing that output, so we want to monitor those numbers. And then option 8, monitor electrolyte levels frequently. This is true. We definitely want to do this. Again, we talked about the potassium. We want to make sure that our level is in a normal limit and that we're replenishing those electrolytes as needed. So your correct answers should be 2, 4, 5, 6, 7, 8. So only 1 and 3 are incorrect. Okay, so submit. We are in the home stretch. We are on question 5. So question 5 is, this is called, for following along in our clinical judgment measurement model, this is a take action. So it's pretty much what it says it is. We're going to take action. We're going to do something. So either we're going to take action in terms of implementing an intervention. We're going to take action if we were having a major consequence of the disease process happening. We're going to insert ourselves into the situation, and we're going to do something that's going to improve an outcome for the client. So in reading this, it says, drag words from the choices below to fill in the blank. So again, the nurse prepares to administer prescribed medications. The nurse should administer blank and blank at this time. So we have, this is a drag and drop, so we're going to drag our options from our little bank here into these option choices. And then it doesn't matter what order they're in, you just have to have the two correct ones. So we talked about our priority intervention, and I'm not going to give anything away. I'm going to check the chat. You guys put what you think the two options are, and then we will answer it. Good job, YouTube. Nav K saying the right answer. I'm not going to give it away. Sorry. Good job on YouTube. A lot of right answers. Very good. Instagram, seeing right answers on there. Good job. Good job. Okay, I think you guys have it. So we talked about our priority intervention for DKA is to administer fluids. We're talking about the ABCs. It's the C, the circulation. We have to make sure our blood can perfuse our vital organs. So that is definitely going to be one of our right answers. And something we've talked about. I probably don't need to explain it too much more, but that's our priority intervention. We're replenishing that fluid volume. We're combating that hypovolemia and preventing hypovolemic shock. The other major thing happening with DKA is those insanely high glucose levels. We know the only way that we can drive glucose into the cells is with insulin. So this is going to be our next option here. So we have to give insulin. When we give it IV, it works faster, and it's going to drive and we can give it over a period of time until our client's blood glucose levels have normalized. So walking through our incorrect answers here, we definitely don't want to give our client more dextrose. Dextrose is like a sugar, so that's what we would give if our client was hypoglycemic, but in this case we're like wildly hyperglycemic, so we don't want to make the problem worse. Potassium chloride IV, this is something we should do, but we need to make sure and give the insulin first. So if we have 3 right answers, these are going to be our 2 most correct answers. And I remember in nursing school, somebody sent me a meme, and it was like an example of a NCLEX question, and it was like, which orange is the orangest? And it gave a picture of 4 oranges that were orange. And I feel like this is one of those situations where you have to find the orange that is the orangest. And so in this situation, giving fluid and giving insulin are going to be our correct answers. And then again, giving 5% dextrose and 0.45% sodium chloride. Those are going to happen eventually in our treatment, but at this time, those are not what we're going to do. Again, we're going to implement that dextrose in our IV fluids once we get to a lower blood glucose level around like 200. And we're going to do that to prevent hypoglycemia while our body is still continuing to process the glucose and process ketones out of our body. So we are good on this one. So you guys did really good on that one. And we'll hit submit. Okay, we're in the home stretch. We're on our last question. So question 6 in the clinical judgment measurement model, this is a evaluate outcomes. So we're going to evaluate the outcomes of either how we treated the client, how we educated the client, any intervention we did, we want to see how it resonated with our client. And so this is going to be what we're going to be evaluating. Okay, so this type of question is called a matrix, oh my goodness. Not matrix multiple response, it's a matrix multiple choice, which essentially this is going to be 5 single best questions. So we're only going to be able to click like correct or incorrect. It can't be both. And then we're going to have to answer each of them. So we'll go ahead and read the question. It says the nurse provides teaching about managing diabetes during an acute illness. So we're thinking sick day management here. For each of the statements made by the client, click to specify whether the statement indicates correct understanding or incorrect understanding. And so I'll read the statements. You guys feel free to like summarize which ones you think are correct and which ones you think are incorrect. So the first one, I should not take insulin if I cannot eat due to nausea. I should drink extra fluids to stay hydrated when I am experiencing an illness. I will check my blood glucose levels more frequently if I am experiencing an illness. I need to check my urine for ketones if my blood glucose levels are persistently elevated. And I will reduce my carbohydrate intake if I experience high blood glucose levels during an illness. And it even tells us on here, each row must have one response option selected. So you guys use the chat. Tell me which ones you think are correct, which ones you think are incorrect, and then we'll go through. Good job. Good job. A lot of comments coming from TikTok. You guys definitely have it right. Good work. I like how everyone's taking their own approach to sending in your answers of like putting incorrect, correct, 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 incorrect, or whatever. Good job. Good work, JC. Good job. Good job, you guys. A lot. Good work. Seeing a lot of good answers come in. You guys are great, and thanks for sticking with us. I know this is a little bit longer than normal, so we're on our last question here. Okay, so I'm going to go ahead and kind of jump in and walk through these. So again, whenever we have a client with diabetes, whether it's type 1 or type 2, sick day management is a big part of that education that as a nurse you'll do, or if you're in an acute care setting, a lot of times there's a diabetic educator that can reinforce a lot of these teachings too and kind of get into the nitty gritty with these clients. But one of those things, especially for this client, they have DKA. We know they have type 1 diabetes if they're in DKA. They're insulin dependent. So we would never tell somebody with type 1 diabetes not to take insulin because they still need it for their body. So this statement, I should not take insulin if I cannot eat due to nausea, this is incorrect. They're still going to need insulin, but that's the whole point of monitoring our glucose. That's going to indicate how much we're going to take. So it might be lower, or needs might be lower, but they might also be higher. So especially if they're acutely sick, we're going to have that stress response. That stress response is going to increase the release of cortisol, which is going to increase our glucose levels. So this is incorrect. Okay, line 2 says I should drink extra fluids to stay hydrated when I am experiencing an illness. This is true. This is a correct teaching. We want to make sure these clients don't get dehydrated and kind of precipitate DKA. We know that that's a big, if our glucose is rising, our fluid volume is going to be decreasing in DKA. So this is a correct statement. And then question 3, I will check my blood glucose levels more frequently if I am experiencing an illness. This is correct. This is a true statement. So again, we just talked about that. Our body's response to stress is to release cortisol, and cortisol is going to increase our glucose levels. So you're typically going to have increased insulin demands when you have an acute illness or a big stress response in our body. Option 4, I need to check my urine for ketones if my blood glucose levels are persistently elevated. This is correct. We want to prevent DKA from happening, or if we're in DKA, we want to catch it at the first sign of like really bad outcomes. So checking your urine for ketones is something you can do at home, and it's something we should instruct these clients to do. And if they see ketones, they immediately need to call their doctor. They need to get seek help for that. Okay, so option 5, I will reduce my carbohydrate intake if I experience high blood glucose levels during an illness. This is incorrect. We still want to, continue to eat. We want to kind of same idea as like that first option. Our body is still going to need energy. It's still going to need carbohydrates. This is kind of where our insulin demands are going to change. So this is something we would not want to instruct a client to do. So this is incorrect. So our correct options are 2, 3, 4. Incorrect options are 1 and 5. So we're going to submit, And then I will just briefly kind of go back. So now that we're at the end, we can see like the great part of UWorld, all of our explanations. So this is going to walk you through why our correct options are correct, what that big teaching point is, and then why our incorrect options are incorrect. So you guys can kind of get an idea of what this looks like. We have amazing images and illustrations in here that you can see with our hyperlinks. You can also see there's different animations as well that you can see, and it's just going to walk you through everything. And one of the great parts about UWorld is our educational objective, which is like a little snippet you can put on a note card and really get that big main teaching point out of what you should learn from that question. And then you can also see we have lecture videos, so you can watch a short, high quality lecture video about the topic at hand, so what the learning was out of this these questions. So that's essentially it. You can kind of see all of these things, but we got 100%. We got all of our points. Well done. That's about it, but I hope this was helpful for you guys. As we always say, come join us Tuesdays and Thursdays at noon Central Time. Next week, we're going to be kicking off Mental Health Month with some of our common psych disorders to help you for your NCLEX and in nursing school, talking about meds. We have our 7-day free trial. Go to nursing.uworld.com. Make sure you subscribe and follow us on all of your favorite channels. You'll be able to see what our topics for our lives are, and a lot of great resources just to help you in nursing school and on the NCLEX. And as always, share us with your friends. Let us know also in the chat what you want to see. So we appreciate your time, and we'll see you guys next week. Have a great weekend. Bye.